Hi, I'm Dr. Traci Kurtzer. I'm the Medical Director of Trauma-Informed Care and Education in the Department of Obstetrics and Gynecology at Northwestern Medicine. I work in the Center for Sexual Medicine and Menopause, and I've been in practice for almost 30 years now, but with a focus on menopause and sexual health issues, really just for the last 8. And I like to serve patients really of all ages, but I would say primarily I am working with middle-aged to menopausal patients in my practice. And that's a little background on me. Well, I think there's a number of ways that we can, as healthcare professionals, help our patients who are from not heteronormative backgrounds to feel more comfortable in a medical setting and particularly in a gynecology setting. And I believe that really starts from even with scheduling the appointment all the way, through checkout. So it's not just with the medical clinical staff, but also with our check-in staff and ancillary staff and treating patients, one, with respect and non-judgmental behaviors and, being aware of the use of pronouns and preferred names for our patients. Again, from, the scheduling process on is one really big step to help our gender diverse patients feel more comfortable. I think from the clinician side in particular, it's really important for us to recognize that this group of patients do come from backgrounds where they may have experienced quite a bit of trauma, and that can be in their personal lives, but it can also very often stem from past medical trauma. So having that understanding and recognition up front is really critical because we want to provide trauma-informed care by really integrating those principles into our, practice, which we should be doing with all patients, but, particularly in this group of patients who've dealt with so much trauma at our hands in the past. So that can look like just making sure that we're empowering our patients, a lot of informed and shared decision-making, patient-centered care, being aware of how our language and exam in particular actions can harm patients or re-traumatize them, so that we avoid that as much as possible. And, we are human and we'll make mistakes. And I think it's always okay to have that conversation with our patients and ask their preferences for how they want different parts of their body referred to, and kind of make sure we've gone through that organ inventory. So just what parts do you have and how do you like to refer to them? And then, a lot of consent and preparation and informing our patients before really any part of the exam, but particularly exams that involve more vulnerable parts of our body. Another condition that comes up a lot in menopause transition, which can be termed hormonal transition or endocrine, transition. So again, you can use different terminology there, is that, again, particularly for patients who have female anatomy but are using medications like testosterone, is the degree of thinning or atrophy of the genital tissues can be quite extreme. And again, our go-to there is often to use estrogen therapy, and that is in some cases just not going to be acceptable, even though it's not. We can reassure patients that it's not getting into the systemic circulation, it's not going to feminize them in any way. It definitely can sometimes be a dysphoria issue being on an estrogen product, and so we have to think creatively with other solutions. This is maybe somebody that just needs to use hyaluronic acid moisturizers and really, use them aggressively, using different, types of devices or products, or considering something like a laser treatment, even though that's not an FDA approved treatment. But again, I think we just have to be very patient-centered and think outside the box sometimes. Unfortunately, we're still at a point where finding a provider that's going to be supportive during this time can be somewhat challenging, but I think we do have some good national organizations to look into for listings of certainly professionals in menopause through the Menopause Society, www.menopause.org. And I do feel it, as a general rule, and I can't speak for every single provider, but as a general rule, that is a very, LGBTQIA friendly and positive organization. Also the ISWICH, which is the Sexual Medicine organization as well. You might be able to find a provider practitioner through that website. You can also just look at, oftentimes practices do have their own website, and I think more and more there's an awareness of how important and what a dearth of options there are for patients. So a practice that is going to be very, friendly and positive for not non-heteronormative patients is going to project that on their, website, or have, things in the waiting room, even stickers or posters, or, people wearing little badges with pronouns, or, things along that line that can be looked for as well if you're in a community where maybe there's more restricted access to a variety of practitioners. And then last, I would keep in mind that a lot of medicine has gone to virtual, and I know there are some restrictions from state to state, but you may be able to find a practitioner who can do a virtual consultation, or be a resource to find maybe somebody else in your community that you can access that's going to be, a positive experience as well. So as a patient, you may be wondering, is there anything I can do? I know I've had difficulties with exam, or have had trauma reactions when meeting with healthcare professionals in the past. What can I do to maybe not have that happen again, or to prepare my team for this to happen? And I think it's really great to do that as much as possible up front. So that's something, even when the medical assistant or nurse is checking you in, because usually there's somebody that sees you before the doctor, you can just let them know that you wanted to have a few minutes to talk to the doctor, or maybe the nurse practitioner, whoever's going to be doing your visit and exam ahead of time, to let them know that you have had really difficult experiences in the past with physical examination or interviews, and that there are a few things that you have learned that help put you at ease, or that can be done if you start to go into a trauma reaction. I can guarantee you that medical staff appreciate knowing that up front, and knowing what they can do to help prevent it, because we don't want our patients to be traumatized, or for us to be a source of trauma for them. But I think a lot of us just don't understand it yet, or haven't been trained in it. So any education, I know it's frustrating when you have to educate your healthcare professional, but that's the reality. And I think it's very helpful for them to know that up front, and know things that they can do to make you have a better experience in their office. And if you have a practitioner that reacts negatively to you talking about that, or giving suggestions, then that's not a practitioner that you want to work with, because they're not going to be supportive across the board in other ways.